One of the other headlines about the whip count, Congressman, roll call, lead story, leaders confident on health bill vote. They say that Democratic leaders sounded bullish Wednesday after launching an all-hands-on-deck effort to win support for what they're calling a robust public option. Caucus Chairman John Larson says we think we have the votes now, meaning 218. Does this mean this is going to come to the floor very soon if they think they have the votes?
I think it's going to come. I think this is all done except the shouting by Thanksgiving time. So we have a few more weeks to do it. You know, we have some breaks here and there. But I think we're getting closer and closer. And not only is this going to happen in the House, I'm convinced it's going to happen in the Senate. I'm thinking the American people clearly seem to want it. People understand the idea here, so I think it's going to happen soon.
Let me add the voice of one of your Democratic colleagues to all of this. He's Alan Grayson, who's made some news recently with statements on the floor, but most recently yesterday, Democrat from Florida, he said Republicans want the uninsured to die quickly if they get sick. That was what made all the buzz weeks ago. He's now set up a website, according to USA Today, where people can post names of those who have died for lack of health coverage. Here's a short piece from the congressman from the floor.
I think it dishonors all those Americans who have lost their lives because they had no health coverage, by ignoring them, by not paying attention to them, and by doing nothing to change the situation that led them to lose their lives. So I make this simple proposal. I propose that we identify them. I propose that we honor their memory by naming them. They themselves can no longer speak, but their families, the ones who love them, they can speak. And so I've established a website called namesofthedead.com. Namesofthedead.com. And I invite all those people who suffered the terrible tragedy of losing a loved one, whether a son or a spouse or an uncle or a mother or father, all of us who've lost somebody close to us, because they had no health coverage, because they had no health insurance, and because they died, I propose that we all go to this website, namesofthedead.com, and we name them. We honor them, we cherish their memory, and we show our respect for their memory by simply naming them.
From yesterday on the floor, there's a look at the website, namesofthedead.com, put together by Democratic Congressman Alan Grayson. Reaction also in USA Today. He says it's intended to honor people who die without coverage. The National Republican Congressional Committee accused Grayson of a shameless stunt in a video I posted of him announcing the website. Does this help with the debate, in your view?
I think it does, in that it gets people to focus a little bit on the idea that this isn't just about vote counts and sections of bills. This is about people's lives. You know, I have a website as well, countdowntohealthcare.com, where we allow people to weigh in on the public option. Every day I give a couple of paragraphs on what's going on the floor. Sometimes I update it more, countdowntohealthcare.com. And what we found is thousands and thousands, more than 50,000 in the first week, signed up on countdowntohealthcare.com to say we want a public option. We looked at where they came from, just about every zip code in the entire country. This notion that this is a liberal or a moderate or conservative notion, competition and choice and lower prices are what people really want. And what Congressman Grayson is arguing here is there are some pretty high costs, not only to society, but to the taxpayers when we don't have insurance for people, or when every day 17,000 people lose their insurance.
Back to the calls for the Congressman. John, independent from Charlottesville, Virginia.
Yes, hello. Thank you, CSPAN, for taking my call.
Sure.
Representative Weiner, by the way, I'm one that went to the website for the countdown, so I'm one of them that did that.
Thank you.
I'm for single payer, but I know we're not going to get that, but the public option, I'm definitely for it. One question, though. I never understand this. How can we get a break if it's going to be for profit? How do we get a break? If you're going to do that for our health, they're going to find ways not to pay out.
You know, that is a great question. You know, the way I ask people to look at it is, would we ever say the fire department should operate as a private business for profit? Because we don't need that every day, but when we need it, we really need it. We all pay in each year into taxes. How come we don't treat health care like that? And the idea that this is like another business is just mythology. You know, if right now, if Paul doubled over and he had an appendicitis attack, he can't say, you know what, I'm going to shop around and get a liver instead of an appendix. Or he can't say, I'm going to wait till December to get my appendix fixed because they go on sale then. he has to get the health care, and very often a lot of Americans are given one choice by their employer of what health insurance to get. So the notion that we're going to treat this like any other business is mythology. You can't really do it, and that's why I think ultimately you need a single-payer plan. But at the very least, if we're going to keep building on this employer-based model, let's give them a little competition. Let's do something to stop them from every year raising rates, and that's what the public option is all about.
What else do you make of the Senate approach to all this and the product that the Finance Committee has put out?
Well, of the 5 bills, the Senate Finance Committee bill is the least good. I mean, I don't know how else to put it. It fails to cover everyone. It fails to provide a true competition, and I don't think it's going to hold down costs. But it's one of 5 bills, and I think the President and Congress should be honored. We're moving further than we've moved in any time in a generation. 44 years ago, I think in July, we passed the Medicare Act became law. It's been a success. It has cost problems like everything else does, but it's been a success. 96% of seniors say they like it. Now we're trying to make a little sliver like that in the public option, and the insurance industry is squealing like a pig. And I figure if they're not squealing, then we're not doing this right. So I think that the Senate's been a little more timid. I think we've got to make sure the majority writes this bill, not the minority. And I think the majority of Americans want a public option.
Last call here for the Congressman. Danny from Crestwood, Kentucky, Democrat. Go ahead, please.
Good morning, Congressman.
Good morning.
You know, the one thing that I keep hearing is, you know, the Republicans keep going back to sell the insurance across state lines. And a whole lot of people I don't think really understands how the insurance companies, of course, and the Republicans want them to be able to do that. They could sell across state lines and sell to, you know, virtually every state in the United States. But they all want to be regulated by whatever state they're in. So if that happens, what they're all going to do is they're all going to run to the state that has the most lax regulations, and, you know, what your state does is not going to matter. It's going to be like, I don't know if you're familiar with Delaware corporations. A lot of people, a lot of big companies have Delaware corporations, and they've never been to Delaware, but it's a very lax tax situation in Delaware, so everybody wants to go in there and use that, you know, as a tax situation. And Delaware uses that as, you know, a very good profit center. And it'd be the same way all the states. Not only would these insurance companies be going to the states with the most lax regulations, but the states would start cutting their regulations to be the new insurance company center of the United States.
Thanks for calling.
Well, you know, you're exactly right. It's a big argument we always hear from Republicans. Let the insurance companies compete over state lines. Well, why is it that insurance companies are regulated state by state? Because they have this most favored industry status of being exempted from the antitrust laws as an interstate commerce, even though clearly they are. But there's another myth about all of this. Do you think Blue Cross of Maine is lining up to go offer service in Idaho? Baloney. They don't want to go set up their own network in Idaho. They're not trying to compete. They're not competing anywhere based on price. They're just trying to get as many people as they can and then hold on to them. And what we're seeing is that there's in states like mine that have 1,000 different health insurance companies, and we say, yes, anyone who wants to come in can do it. Rates have not gone down, they've gone up. So the idea that health insurance companies want to compete, if they wanted to compete, they can do it now. And here's one other thing I'd say to my friends who think that that's the solution. In the 50 states that all individually regulate the insurance industry, do you know how many applications there are from an insurance company from another state trying to come in? 0. They're not trying to do it. They don't want to compete. They like it just the way it is because they're getting fat on the tax dollars that we're paying and on the premiums that we're paying.
Congressman Anthony Weiner, Democrat from New York. Thanks a lot for your time this morning.
Well, thank you very much. It's been a pleasure. I love Washington Journal. I always wondered as you host whether you're wearing any pants under there.
Oh, we're definitely.
And I want to make it very clear that Paul is wearing pants.
Definitely. We all do. Thank you very much.